My name is Geis. I'm the Bariatric Program Manager for Nanticoke Weight Loss and General Surgery. We currently run 2 support groups a month for our bariatric population. They are a wonderful group of people where we learn how to do behavioral modifications, and we do specific behavioral modifications such as mindful eating and getting back on track, exercise. Weight loss surgery is a tool, and by going to support groups and learning the behavioral modifications that go along with surgery, we can really set our patients up for success by hitting on specific topics that would ultimately lead to their continued success after weight loss surgery. Our support groups are geared towards our bariatric patients that are currently going through or have had surgery. We're able to reach out to that specific population, and it has become a community because they all are supporting each other on the journey that they're all going on, because they all have the same struggles. So it's nice that they have each other to ask questions and bounce off ideas. We have a closed Facebook group for our bariatric population. It's NMH Bariatric Group. That is a closed group for our patients. It's an online support group, and again, the support that all of our patients give one another, they're cheering each other on. They have a bad day, if they've kind of gotten off track a little bit and they're eating things that they shouldn't necessarily should be eating, that's a safe place for them to come and get the support to get back on track. We also have a group for our non-surgical patients that they're still struggling and they still need that support, but it's geared towards the non-surgical patients, and we're still able to give them the behavioral modifications that they need to lead them to success as they continue on their weight loss journey. We are very honored this year to be able to put on a 5K fun walk run for our bariatric population, as well as friends and family and hospital staff. A lot of these folks have not even thought that they would be able to do a 5K, and here they are registered for their first 5K. It's going to be an amazing event for many of reasons, and there's going to be a lot of folks that never thought that they could do this, and that they did it, and they set their mind to it, and they worked hard, and hopefully this will be just the beginning for them on many other 5Ks, and hopefully at some point leading to a 10K for them. All of these patients are in the same boat, and they all have each other to rely on. Our patients not only come to support group, are doing the 5K, but they, once a month, they will go out and meet as a group separate off-site, because they've all become friends. 3 times a week right now, several of our patients are meeting at the high school and walking together. And they're all doing things that they never thought they could do, and they're all doing it together, and they're all, most importantly, they're all encouraging each other and cheering each other on to do better and to be better. And that's the most important thing. They're trying to be better. Our staff at the office, we are so very blessed to have the staff that we do. And there isn't one of our staff members that wouldn't do anything for any of our patients. Our patients know that at any given time they can call anybody in our office and we'll all be there. We see them every single month, and a patient will come in and they will get weighed and they will lose 5 pounds, and our staff is clapping and giving them high fives, and it just does not stop with Dr. Wackhead and Dr. Palvicino, but it goes all the way down to when our patient's checking out, and they're still congratulating them on the weight that they've lost, or whatever the accomplishment that they needed to accomplish that month. We are very goal driven within our practice, and we give very reasonable, achievable goals. If you go to nanticokeweightloss.org, you can register for a seminar given by Dr. Wackhead for surgery. Again, for the surgery seminar, those patients need to have a BMI of 35, between 35 and 39.9 with one or more comorbidity, or anybody with a BMI of 40 or greater, no comorbidities. Also on the nanticokeweightloss.org website, you can also ask questions, and it will come directly to our office. We can give you a call if you're unsure of what your BMI is. We can figure that out, and then we can get you registered for a seminar. If surgery is not something that you would like to do, we also have our non-surgical program with Dr. Palvicino. Again, we'll get you scheduled for a group orientation with Dr. Palvicino and go down the non-surgical weight loss path. If you would like to know more information in regards to our programs, you can go to nanticokeweightloss.org or give us a call.